pandemic, there was a disproportionate toll of both infectious and also non-infectious repercussions on communities of color within Canada. We also know that the pandemic meant that families had less access to parenting supports, both from their organic parenting communities, aunts, uncles, cousins, and neighbors, and people on the playground, like classmates, parents, etc., but also in terms of access to healthcare and screening as well. We know that this has led to increased anxiety and worry and disconnection amongst parents in these communities, and we wanted to create a space where families could access evidence-based health information, which would allow them to parent and make parenting decisions with confidence, and also a space for them to be able to connect with other families that may share a similar cultural linguistic background and approach to parenting, to be able to access support in that way.
We have created an online social media platform called Our Kids Health. It is a free, bilingual, culturally congruent parenting resource that's tailored to the needs of 10 different cultural linguistic groups.
As a practitioner, this is really important to me. We know that mobilizing health information and data can take such a long time as we put it into policy and roll it out in a way that's accessible for diverse communities, particularly ones that have diverse cultural linguistic experiences or needs or perspectives. And so this is something that's been really helpful for the practitioners that are on our platform to be able to use this structure that's been created as a part of this project. These are things that we don't learn in residency. We learn about clinical medicine, but being able to bring it out to a large online community in this way has been really helpful and impactful.
There are monthly live Q&A sessions on a specific topic where the online community members can interact directly with the study team.
It's been neat in the comment sections as well to watch community members answer each other's questions, to share their lived experience. So we have parents sharing their experiences from the pandemic, strategies that might have worked, resources that they find helpful as well. We know that sharing interventions around early childhood development in this multi-generational sort of way where you're supporting parents, sometimes grandparents as well with this content, and the impact that it has on children in other large studies has shown to improve outcomes for families in terms of development, but also educational outcomes and also long-term economic outcomes for families and for communities as a whole.
What I'm hopeful for is that these resources will be useful for families who have nowhere else to turn, and that we can provide them with culturally appropriate information that's useful in their everyday lives.
I think that a lot of interventions around mental health promotion and parenting historically have really focused on what practitioners think are priorities and are important. But I think this method of using social media and having a live curriculum that evolves with the needs of communities and what we're hearing from them is really exciting and responsive. And I'm really excited to see, again, what we hear as priorities and what the outcomes might be.